So now, as we are already in the response, we are going to discuss what are the measures or what are the activities that we do so that we limit the spread, but also we take care of the positive cases identified. So we must always try to get the case as early as possible. We must identify. How we do identify the cases is to do screening at each point of entry for all people entering healthcare facility. Once we find suspect case, we need to isolate, to put aside that suspect case until proven negative so that they can resume the routine care, or they are declared positive and then they go for treatment. And then we have to notify. Once we have identified the case, we have to notify. The other thing which is key or a pillar of controlling the transmission in addition to screening is infection prevention and control measures that we have to apply appropriately. We are going to see which one. So for those who are not familiar with the terms we have used, screening is the process to identify a potential individuals meeting a standardized case definition. For example, in case of Marburg, we have a case definition that I will show later. And we make a case definition, and then every person entering the facility must be screened against that case definition. Once the person is meeting the criteria, for example, having fever, diarrhea, vomiting, headache, and you are in a case of outbreak, this is a person to put aside. However, when we talk about screening, there is a second term that is commonly used, which is the triage. Triage is the process of sorting patient. For example, if we have like 50 people on a queue for any given services, we can sort them asking, for example, how many people have these different symptoms, like how many people have fever, you can be on one side. How many people who are having bleeding, for example, they can be on other side, so that you can retrieve people according to the severity of the symptoms they have. And if they require urgent management, they can be categorized aside and then taken care. For example, in our case of Marburg, we must identify people with emergency signs, like someone having bleeding or someone having vomiting or diarrhea. That is a person who cannot wait on the queue. And then we have cases with priority signs. These people, when we are doing the triage, the people with emergency sign are the one we code as red. They require immediate medical or healthcare attention. And then for the people with priority signs, they can wait a bit, but not long. For example, is someone having fever, headache, and is among other people who have no symptoms, that person should be put also aside. In that situation, in our triage area, they will be labeled as yellow. And then we have cases with no priority or emergency signs who are labeled as green. Those people, they can wait for a bit or longer time compared to the ones with emergency signs or priority signs. The triage help to reduce the transmission in the way that if you find someone who is, for example, bleeding, and we already know that blood is the most highly infectious body fluid, once we identify that person among many people and we put that person aside as early as possible, we limit the transmission. So what are now the key concepts when we are talking about screening? Screening should be conducted at all entry points of healthcare facility so that we can limit or stop the introduction of infectious disease in the facility. At the area of the screening, we should have a questionnaire which is giving us the case definition. And then we have to check the temperature because it is one of the key symptoms in this outbreak. If the person is not having fever, we can ask about the history of fever in the last few days. And then we must have clinical judgment. If the person has already, you found that the person screened is having fever, and then they report headache, they report diarrhea, clinical judgment is to put that person aside on hold so that the person can be taken care of before entering into routine care. So screening is a key component of patient care pathway because it's going to limit the spread of infection in the facility. If a patient screened positive, they should be immediately transferred to isolation area. And that's why we request all the hospitals in our country to have a specified area where they place those people who are tested positive. In some setting, they just find temperature and then they let the person go. That is not a good practice. We must have in our setting a place reserved to keep those people and to take care of them, not just to leave them in those rooms. And then this regular screening must be done so that we can get the case as early as possible. We have to screen patients, healthcare workers, as well as visitors. So these are the things that must be put in place of the screening. We must, because most of the point of entry, most of the people are, I may define them as stable, except for the emergency entry, maternity ward, for example, entry. In those special area, we can receive people in ambulances, but on the major gates, we normally should screen, trying to keep a distance between the screener and the person to be screened. If we can keep a minimum of 1 meter distance, therefore we can protect the screener, but also the person to be screened, we do not need to wear too much of PPE as we are going to see. So the screener must know what to look for. They must follow the case definition and they must protect themselves, specifically applying standard precaution, IPC standard precaution, and transmission-based precaution. The screener must know how to use the equipment. For example, the thermometer, because it is the one which is going to help us to know the temperature. It is advisable to use a non-touching technique when we are taking the temperature, and we are advised to keep that 1 meter distance. Personal protective equipment like gowns or other like coverall are not required at the screening area if we can keep 1 meter distance between the screener and the person to be screened. Here it is an example of a healthcare worker and the person who is being screened. To maintain 1 meter distance, a table has been put in place so that there is no possible difficulty to reach or to touch each other the time they are doing the screening. Once this distance can be maintained, the personnel who is doing the screening can just put on the scrub. No other necessary PPE required, but they must have hand hygiene facility like hand rub or hand wash. So in case of triage, this is what is required in case of screening. If we cannot maintain 1 meter, then the screener must have a medical mask, eye protection, fluid-resistant gown, and 1 pair of single gloves. And of course, they must have hand hygiene facility, like hand wash or hand rubbing. At the triage, because the triage, most of the time, we cannot keep 1 meter distance. We need, in most of the situation, to be in contact with the person to do the triage. Sometimes there are those patients who are not stable, the one you can give the hand to hold. They must wear coverall at the area of triage, or if it is not available, they can put on gown with head and neck covering, medical mask, eye protection, and 2 pair of gloves, because they will be doing clinical examination in most of the situation, or they need to transport unstable patient who cannot walk alone. So once the person is screened, and they must have also closed-toe shoes boot. These are the PPE for someone who is doing the triage. You see the boots, of course, the boots are put on after putting on the scrubs. And then we have the coverall. And then we have the gown. We have the mask, of course, we have the face shield. And then we have the gloves. So measuring the temperature can be done by infrared digital thermometer or manual thermometer. So in the situation we are using a digital thermometer, it is easy to keep 1 meter apart, and then it must be pointed at the level of the temples, leaving 5 to 6 centimeter. And remember, the screener must take a distance of 1 meter between her or him and the person they are screening. When we are using a manual thermometer, the screener must also keep 1 meter apart, and then must ask the person to be screened to raise the hand so that she can put the thermometer in the axilla. And then once the thermometer is pressed, the person put down the hands, and then she wait for the time the thermometer mentioned that the temperature is recorded, and then she can take back the thermometer. And here you see it is non-touch technique. And here she has put the gloves because there may be possibility to touch the clothes of the person. So now, screening area, as we have said, we must have hand hygiene. For all the people entering in the facility, we must have a hand hygiene station. We must have a chair. For example, once we found a positive case, may be put aside so that we coordinate the rapid response team or the people in charge to take the person into isolation the time the screening continue. And then that person who is screened positive can be put on the chair aside for a while. And this chair must be cleanable and disinfectable. And then for the screener, we must have also hand hygiene supply, physical barrier whenever possible, a table or a desk to keep 1 meter apart. We must use non-contact thermometer and spare batteries, because you cannot stop the screening because the battery is over. We must have a case definition and the algorithm, the way after seeing a positive case, what is going to do or what is the next step. And then we must have, if we can keep 1 meter, we do not need PPE, but if we cannot keep that 1 meter apart, we must have basic PPE. For the cleaning and waste management, because we have seen that in some area we need to use gloves or sometimes basic PPE, we must think about the cleaner who is going to decontaminate the chair we put there, or the waste that has been generated, for example, at the hand washing station, or the gloves used in any situation, or the material that we have used to clean the hand. So the cleaner must be also prepared, as well as infectious waste bin must be availed. So this is an example of case definition that can be used. As we have said, fever is the key feature that we are, or symptom we are looking for. If we measure, we can measure the temperature and then we find it is 38 or above, or if it is not there, we can ask about recent history of fever to the people entering in the hospital. If the fever is present, we must have other 3 or more symptoms. Like these are the symptoms that we are looking for: headache, vomiting, diarrhea, all these ones. If fever and 3 symptoms are present, it is yes, this is a suspect case. A second suspect case is a person having fever and has traveled to Marburg affected area. For example, in our setting, if you are in the Ruhengeri hospital and then the person is having fever and is telling you he has been treated at Infant Hospital or at Sehashka, because these are the main hospital that suffered or where we identified many cases of Marburg, this is a person to be considered as suspect case. Or the person has fever and has been in contact with Marburg patient, alive or dead, or is having fever and bleeding. This is a suspect case. There are some situations where we don't have fever and no history of fever, but we have unexplained bleeding. This is a suspect case. All these cases must be put in isolation and then tested for Marburg or Ebola, so that we can know they can proceed with routine care if they are negative by the laboratory, or they can be remaining in the treatment if they tested positive. Once we have identified a suspect case at the screening area, we do not have to panic. We have to be calm and explain to the patient the situation, explain to the caregiver who accompanied the patient what is going to happen, that they are going to be transported to isolation, and then they are going to continue to receive care. Of course, it will be presumptive management, that they are going to be tested, and then they are going to be released according to the result of the laboratory. Once you have explained to the family and the patient, they are going to be compliant to the regulation in isolation. So whenever you are doing, avoid contact with patient or body fluid. Stay at least 2 meters from the patient once you are discussing about those, explaining the situation, and transfer the patient to isolation. Here, what we do at Sehashika, for example, once a person is isolated, is identified as suspect, is set apart, and then they immediately call IPC team and the coordinator of the outbreak, and then we go to the site of identification to direct the person how is going to be transported to the isolation. So if the person can walk, we can keep distance, walking beside or behind toward the isolation. If they are unable to walk and we need assistance, the person needs assistance, the person who is going to bring like a wheelchair must wear extended PPE, and we have to find a way that is going to be used from the screening area to the isolation. And we have to avoid a route where the person can expose many people. We have to look for the route which is avoiding to meet different people or passing through other departments, and disinfect the screening area. Notify public health authority. Here we notify the coordinator of the outbreak, and treat patient respecting IPC measures. I emphasize on treat patient because in many isolation, because people are fearing to enter in those rooms, many patients are dying in isolation, waiting for the care. So once you apply IPC measures, you can treat the person presumptively waiting for the confirmation or exclusion of Marburg. So when you are setting isolation, there are key components that must be thought of the time we are setting isolation. We must think of having a clean area, and then which most of the time we label as green area, and then we must have isolation area, which is most of the time identified as red zone. And then here it was mentioned that here it is the screening area. Why do we need those two separate distinctly areas? Is to allow to apply IPC measures appropriately without contaminating healthcare professionals, but also other people moving in the facility. In the clean area, we must have area where the healthcare workers do their changing of the clothes from home. They must have area where they have to put on PPEs, required PPEs, but also wash facilities for the personnel who are in the clean area. Then in isolation is where we keep the suspect case or positive case. We must limit the movement in this area for the patient and the caregivers. Normally, whenever possible, we must have a restriction for caregivers. And then whenever someone wants to enter in isolation, as long as is not the patient, must wear appropriate PPE. And in this red zone, we must also have area to remove the PPEs as we are going out of the isolation. It is ideal to have a one-way direction in isolation because it is going to limit the spread of the disease. So each facility can either have a built-in isolation or they can try to take a usual ward or a building and transform it into isolation in case of outbreak. So we have to immediately place the suspect case in isolation area so that we limit the transmission. Isolation area should be separate from other clinical area, and we must put signage that show this is isolation. Whenever possible, we can even put the alarm ribbon. Isolation area should be only for one disease. For example, in this case of Marburg, we have to keep only suspect cases or positive cases only. We do not have to mix TB, tuberculosis, and Marburg. If we say this is for Marburg, we must only keep case for Marburg. We have to minimize direct physical contact as possible, but we must ensure adequate cleaning and disinfection of these areas. And as we are going to see the cleaning environment, you have to go from clean to dirty. We have to ensure that no healthcare worker exposure or visitor in our isolation by putting in place all those restriction measures. So what do we need to have in isolation? We must have equipment for patient, item for patient care, item for cleaning and disinfection, and item for waste management. It is preferable to have single room with one bed and preferable to have self-contained. It is advised not to cohort suspect and positive cases so that we do not suffer from cross-contamination. We must have food and water access to those patients, either by hospital supply or other means that can be defined by the facility. We must have hand hygiene station We must have access to dedicated sanitation or latrine or toilet. Here is advised to have a self-contained bed or room, sorry. So for patient care, it is preferable to have dedicated area outside of the unity with PPE for healthcare workers. This is the donning area. We must have hand hygiene stations and then specific equipment for each patient whenever possible, and have unidirectional flow and signage, as I have said, so that we do not go from green to red, then red to green. It should be green, going to red, and then come out without going back. You must have cleaning and disinfection equipment, soap and water, detergent, and chlorine as the disinfectant. And then you must have equipment for isolation, which should not be used in other area of the facility. And the equipment for green zone must be kept for green zone. The equipment for red zone must be kept for red zone, not interchangeably. We must have waste management facilities, specifically the appropriate waste bin, bags, red bags with the mark of biohazard, and then we must have sub-container, and then we must have area to remove the PPEs, and of course, hand hygiene station. So what can we say about visitors and caregivers in case of Marburg virus for the people in isolation? Normally, we need to explain to the family members and visitors that the situation that Marburg is highly infectious, and we must explain why their patient is put in isolation, and we must ensure them that the care is going to be continued, because most of the family members are afraid that the person has put in isolation and is not being taken care of. So we must assure them that everything will be well. And we must ensure the family that even if their patient is positive for Marburg, they are going to be taken care of. This secure the family and it reduces their movement toward the isolation. If it is necessary that a family member is requested to be in isolation, we must explain to them the precaution to be put on, and then they must be assisted to enter into the isolation with maximum protection, and possibly explain to them that they will be also tested. For example, if it is the suspect is the baby patient, the mother most of the time has to stay with the baby. In that situation, the mother must be tested as well as the child, and then the mother must know the restriction for isolation so that she does not move around in the facility while she must stay in isolation. So now when it comes to the IPC requirement, we must follow the standard precaution, as we always say, for all patients and in all situations. But when it comes to Marburg, apart from those standard precautions that are mandatory, we have to add transmission-based precaution. And in this situation, there are direct and indirect precaution that we have to put in place. In the WHO guideline, they have already defined different personal protective equipment to be used according to the task that is going to be performed. So here is again a reminder of what is direct and indirect transmission. As we have said, direct is immediately to be indirect with body fluid that is from the infected person, and indirect we are contaminated by items that are contaminated by those body fluid. So healthcare are the people on high risk, as well as the cleaners who keep the environment decontaminated, as well as the people working in equipment they use or in laundry. So they must use a transmission-based precaution to be protected. So why do we need to use the PPEs? It's because mucous membrane are very thin and they can easily allow the virus to be transmitted. Therefore, they must be protected, specifically wearing a face shield or goggles to protect the eyes. And you must put medical mask or N95 mask for the mouth. Facial protection are the last to be removed during the doffing procedure so that the mucus are protected during the whole process of doffing. PPEs covering clothes should be put after putting on scrubs, medical scrubs. And then they consist of coverall, which is the most commonly used in this situation. Have the stock, but if coverall is not available, we can use gown and head cover as we are going to see. And we have apron that is added to coverall because at the area of the zip on coverall, it is a potential weak area that can cause transmission of the virus through that zip area, because it is not waterproofed. Though the coverall itself is waterproof, but at the zip area, it is not waterproof. That's why we add up the apron. The respirator is used in all the situation when we are wearing the mask, specifically when taking care of suspect and positive case. But if the stock is not sufficient, they can be reserved for the time of doing aerosol generating procedure. For example, when they are putting the person on mechanical ventilation, this is an aerosol generating procedure. For example, if they are doing like endoscopy or other procedures that like basic life support, they have to put the respirator. We have the footwear where we put the boots, and then we have 2 pairs of gloves. These are the most PPE, but they must be selected according to the task, the risk, and the knowledge to use those PPE. So this is a note that has been taken from the summary of the WHO guideline for Ebola and Marburg virus disease. And in this outbreak, you are going to see that there are different numbers, 1, 2, 3, something like this. They goes with the task to be performed and the PPEs that are going to be put on. For example, if we talk about 1, it goes with the screening where we need the minimum of PPE. The second task, like screening, when we cannot keep 1 meter, we have the triage, we have patient care and environmental services. For example, if we have a patient identified at home, this person must be transported at the facility. So here we are going to use PPE for patient care, and we have to decontaminate where the person has been identified. That's why you put this number 5, so that you do not get confused with these numbers. So this person must be transferred to the healthcare facility. So they must apply required PPE for patient care and required PPE the time they are decontaminating the ambulance. However, when we are doing screening and then we can keep the 1 meter distance, no PPE required. But if we cannot keep the distance, we are going to require the PPE at the level number 2 that we are going to see in the table below. And then if the cleaner is coming to clean a area of screening, must put on environmental appropriate PPEs. So at the area of screening, then if the patient screen negative, they must enter the care facility as usual. If it is positive, then they must be triaged to see if there are many people suspected at one area. We must see who is at high risk having emergency symptoms to be taken care of. And then during this screening, we put on the level 3, I may say, 3 PPEs and environmental cleaning to remove to clean the area of triage. In case of isolation, we do only patient care and environmental cleaning. Once the person is cured, they are discharged, or if they deceased, we use the environmental PPEs. So here is now the table to go with those numbers. As I've said, if we can keep 1 meter apart during screening, the person can put the scrub and then the crossed shoe, the crossed two shoes. If the screening and keeping 1 meter cannot be respected, the person must put on scrub plus fluid-resistant gown, must protect the mucus by putting on the medical mask and put on the eye protection, face shield or goggles. At this level, they must put on 1 pair of gloves because they cannot keep 1 meter distance. And of course, crossed two shoe is part of the scrub uniform, as I may say so. In case of triage, it will be almost as if we are doing the patient management or patient care. We put on the scrub and cross the two shoes and fluid-resistant coverall. This is an alternative when we don't have coverall, where we put on gown and head cover as well as neck covering. Those we usually call hood. And then they must protect the mucus, mask, and eye protection. They must put 2 pair of gloves, and these are the same as the almost at the level of patient care, except here we use, in addition to this coverall, we add the apron, which can be disposable or reusable. So if there is no, when you are in treatment area, like in isolation for suspect or positive case, we put the scrub, we put the boots, and then you put a coverall and an apron. And then this is alternative when you don't have a coverall. And then you have eye protection and medical or N95 mask, 2 pair of gloves, and these are the PPE that we use, and then we treat people, and then we do not get contaminated if we use them appropriately. So environmental services and burial, it is the same. We put the scrub, we put the boots, of course, and then we put coverall and heavy duty apron. So you are going to see that the variation are slight, but they are so key. So here we add heavy duty apron, and then we can put we have to put a mask and eye protection. And they have said in case we have sufficient stock, we can always use respirator. But if the stock is limited, the respirators may be limited to aerosogenating procedure. But for burial and patient care, I think it is advisable to use respirator whenever possible. And then 2 pair of gloves. The difference here from the environmental versus patient care, the second pair of glove is heavy duty glove, while the inside glove is the neutral glove. And then you have waterproof boots. So this is the way we select the PPE, and there are principles to put on PPE and remove of PPE. This was a slide for showing full PPE. PPE are good when they are used appropriately and selected according to the risk we are exposed on. And always have trained the people, not only the one to put on PPE, but also the one to serve as buddy or supervisor during donning or doffing. We must have posters as reminders of different steps to put on and put off. We must have to check the PPs if they are not damaged.